Hi there. My name is Ben Davidson. I'm a neurosurgery resident in Toronto, and I'm working on a PhD being supervised by Nir Lipsman and Clement Amani. You can see the title of my talk there, and I wanted to thank the Focused Ultrasound Foundation for their generous support of the clinical trials that I'm going to be discussing. I have no conflicts of interest to declare. As many of you may know, 1 in 4 suffer from a mental health disorder. Among the most common are depression and OCD. Approximately 2/3 of patients will improve with conventional therapies. However, 1/3 do not, and they're termed treatment resistant. This is the patient population that I'll be primarily focusing on with this talk because they may benefit from more direct to brain neuromodulation interventions. We know that the symptoms of OCD and of depression are driven primarily by aberrant activity in the limbic corticostriatal circuitry. This is a circular path that projects from the prefrontal cortex to the ventral striatum and to the thalamus. Fortunately, the fibers in this pathway converge in a bottleneck region known as the anterior limb of the internal capsule. And a common psychiatric lesional neurosurgery procedure is known as the anterior capsulotomy. Historically, it was performed with open surgery as well as with gamma knife radiosurgery, which uses ionizing radiation. But recently, it has become possible to perform this same procedure with focused ultrasound, avoiding any radiation or skin incision. The objectives of this talk are to discuss our initial clinical results following focused ultrasound capsulotomy, as well as the structural changes and metabolic changes following focused ultrasound capsulotomy. After treating 12 patients, 6 with OCD and 6 with depression, we found no serious adverse events. There were some non-serious mild adverse events that were quite transient, things like headaches and mild swelling, but very mild. There were no significant cognitive deteriorations, and in fact, there were several areas in which patients improved their cognition. In terms of clinical results, among the OCD patients, 4 out of 6 achieved the pre-established criteria for a clinically significant response, and among the depression patients, 2 out of 6 achieved this pre-established criteria. Then looking at structural changes in the brain, which are occurring following focused ultrasound capsulotomy. The first sign that there was really something else going on besides just the lesions occurs simply from looking at a structural T1 scan. If you look, the blue arrows indicate a postoperative day 1 lesion, and more interestingly, the red arrows indicate white matter changes, which seem to appear not after day 1, but after several months, suggesting over time there's some white matter degeneration occurring. We performed diffusion tensor imaging to look specifically at these tracts, and we do find that their density are reduced over time after focused ultrasound capsulotomy. It's possible to look at specific subsets of these tracts, such as those projecting to the medial orbital frontal cortex or those projecting to the lateral orbital frontal cortex. And then we can look in each subject and see how the density of these tracts change over time, and also begin relating these to lesion volume and even to clinical response. We find that it's related to lesion volume, but more important is probably the position of the lesion itself. We've not yet seen a significant correlation with clinical response, but it's probably because of the fairly small numbers thus far. We also see a slight reduction in caudate subcortical volume shown on the left and right here. Similarly, we're also seeing a reduction in the surface area of the pars orbitalis and the orbital frontal cortex, the other endpoints of the tracts that we're targeting. And then more diffusely, we're seeing reductions in cerebral glucose metabolism shown on positron emission tomography here, beyond just the tracts that we're targeting. So in summary, focused ultrasound capsulotomy is safe, and it displays preliminary signals of efficacy for OCD and for depression. It results in targeted white matter degeneration, endpoint cortical changes, as well as widespread metabolic changes. In terms of future directions, we're continuing to treat more patients, so we hope to have a larger sample size to report quite soon. We're also beginning a multi-center lesion analysis study to look at those individual tracts I was describing and how each one might be involved in certain symptoms. And finally, we're combining these analyses with functional connectivity studies for more of a multimodal approach. Thank you very much for your time.